Welcome to the BanishCancer channel. I'm your guide, Sarah. Today we're exploring how telehealth is transforming healthcare access for underserved communities. If you've ever struggled to reach a doctor because of distance, cost, or lack of transportation, this story is for you. Let's start with the big picture. During the pandemic, telehealth visits skyrocketed by over 3,800%. What was once a rare option is now mainstream. Today, about 22% of outpatient visits happen virtually, compared to less than 1% before 2020. For rural patients, this shift has been life-changing, opening doors to specialists who were once hours away. So, who are we talking about when we say underserved communities? Health organizations like the CDC and HRSA define them as groups that are socially and economically marginalized, often with too few providers and high poverty rates. This includes rural residents, elderly individuals, blue-collar workers, minorities, people with special needs, and even those experiencing homelessness. These groups face unique barriers, from transportation challenges to language differences and provider shortages. Let's break down some of those barriers. In rural areas, the uninsured rate is higher, and mortality rates for conditions like heart disease and cancer are worse than in urban areas. Transportation is a huge issue. One study found that nearly a quarter of patients missed or rescheduled visits because they couldn't get reliable rides. For low-income families, even bus fare can be a barrier. And when you add in provider shortages, with many communities lacking specialists like rheumatologists, the gap in care grows even wider. This is where telehealth steps in. By connecting patients to providers through phones, tablets, or computers, telehealth eliminates the need for long trips. Imagine living in a rural town where the nearest hospital is 2 hours away. With telehealth, you can consult a doctor from your living room. For Native American communities and other isolated groups, this has meant faster treatment, more consistent follow-ups, and better management of chronic diseases. Telehealth also helps older adults and people with mobility challenges. Instead of worrying about stairs, buses, or arranging childcare, they can log in from home. For patients with chronic conditions like diabetes or high blood pressure, regular virtual check-ins mean better monitoring and fewer complications. Another major benefit is expanded access to specialists. If your local clinic doesn't have a cardiologist or mental health provider, telehealth can connect you with one across the state, or even across the country. During the pandemic, telehealth visits increased across nearly every specialty, and no-show rates dropped compared to in-person visits. Some clinics even set up telehealth rooms with the necessary equipment, so patients without internet at home could still connect with experts. And let's talk about cost. For families living paycheck to paycheck, healthcare expenses can be overwhelming. Telehealth reduces out-of-pocket costs by cutting travel, parking, and childcare expenses. One program reported saving over $24,000 in just 7 months. On average, a telehealth visit costs about half as much as an in-person visit. Patients save anywhere from $19 to $121 per appointment, often by avoiding unnecessary emergency room trips. Government support has also played a big role. During the pandemic, new policies expanded Medicaid coverage for telehealth in all states. Federal funding has helped bring high-speed internet to more homes and clinics, making virtual care possible in places where it wasn't before. Real-world examples show just how powerful this can be. In Bangladesh, the Hope Foundation used telehealth to reach nearly 500,000 patients, including refugees. In Nigeria, a program called Precious Gems expanded access for rural patients and built local capacity. In Ethiopia, the Born Initiative increased stroke treatment rates and trained providers through telehealth. These stories prove that virtual care isn't just a temporary fix, it's a sustainable solution. Telehealth also addresses cultural and language barriers. 1 in 5 Americans report difficulty communicating with healthcare providers, and for Asian American and Hispanic patients, the numbers are even higher. Virtual visits can integrate translation services more easily, helping patients feel heard and understood. That builds trust, something underserved communities often lack in traditional healthcare settings. So, what does the future look like? Expect to see more mobile health clinics reaching rural areas, more remote monitoring tools for chronic conditions, and new digital platforms that lower costs while improving care. Artificial intelligence and better data sharing will also help doctors personalize treatment and spot problems earlier. Here's the bottom line. Telehealth is more than a convenience. It's a lifeline for underserved communities. It reduces barriers, saves money, and improves outcomes. Whether you're in a rural town, a low-income neighborhood, or simply someone who struggles with transportation, telehealth brings healthcare to you. Stay proactive, stay informed, and remember, access to care should never depend on your zip code. Thank you for joining me on the BanishCancer channel. I'm Sarah, and I'll see you next time as we continue to bring clarity, compassion, and knowledge.